Welcome everybody to this evening's presentation. My name is Linda Craven. I am the Community Health Coordinator at North Kansas City Hospital. Today's event is a program called Play to Win. We'll be talking about kidney health and giving you all lots of information, hopefully that you'll find really useful. I'd also like everyone to know we are recording this event. Okay, so we're just going to get started here. I am your kidney health coach today. I'm like the coach of the team, so this is going to be fun. We're going to break out a playbook later, and we're going to look at some offensive and defensive plays to help keep us on top of our kidney health. We'll get started here. Perhaps. There we go. So to start off with, when a good coach probably should tell everybody what we're talking about, the topic, and give you guys some good information about the kidneys. So we're going to start off here. Our kidneys are vital organs. Most people have two kidneys. They're bean-shaped and they're located up toward the mid-back on each side of the spine. Now, I said most people have two kidneys. Sometimes there are people that are born with one. We do need our kidneys as they are the filter of our body. So each kidney connects to the bladder by a thin tube called a ureter. And if you guys can all see the picture there, we've got the kidneys, bladder, and ureter identified for you. Okay. So now, what do the kidneys do is the next question. So our kidneys are the filter for our body. They filter out the waste, out of the blood, and then that's eventually excreted in the urine. So we need our kidneys to do that vital function for us. If we are not filtering properly, then our body, we become sick and ill, and then we have to look at some different kind of treatment to help take care of that. The kidneys has thousands of tiny, little bitty tiny filters that are in the kidney, and the blood comes into the kidney and it carries waste. The kidney filters out all of the waste, and then the blood moves on through the kidney, and the blood that comes out of the kidney is all clean and free of waste. And then that blood is pumped throughout the body to help us continue maintaining all of our normal functions. Another purpose of the kidney, it helps keep the right amount of minerals in the body. So that would be like potassium, chloride, sodium. It kind of helps maintain a good balance for us. It can also help control our blood pressure, keep our bones healthy, and it helps the body make red blood cells. So the kidneys, like I said, are very important. We really need to take care of them and be aware of what causes problems, be on top of those problems, make sure we keep our doctor's appointments and that we know what we're doing here. So when we think about kidneys and they start having problems, if you compare your kidney perhaps to a drain in the shower, we know that when we turn the shower on, the water comes down and drains freely right out that drain with no problems. So if something happens and the drain starts to get clogged up, maybe with hair or anything that falls into the tub, we know that drain will clog up and the water will back up. And so all of the dirty stuff is still in the bottom of our shower because our drain is clogged up. So as far as we compare that to the kidneys, the same thing basically happens. If we have some reason that the kidney is not working properly, everything starts to back up and it remains in the bloodstream, and that's where we get our health problems. Our next slide here shows a picture of a chronic kidney disease. The one on the left is the healthy kidney, and the one on the right is damaged. And when we look at the picture itself, you can see the dots there, we have red ones, and then we have some dark black ones. The red ones we were going to consider being blood. The black ones is the debris and the waste from our body that we need to get rid of. And you can see here it flows into the kidney, and right below that, the blood goes through the kidney, filters out the waste, and it's eventually excreted through urine. And then on the right-hand side, you see that the cleaned blood comes back out of the kidney, and that's what goes to the rest of our body. The second picture on the right shows that this kidney is damaged. So we can see the blood entering the kidney with all the waste and debris. And you don't really see below that, you don't see that the waste is being filtered out beneath it. But yet it's coming back into the bloodstream on the right. So we have a lot of debris in the bloodstream that did not get cleaned out. And that's where we start running into some pretty serious problems. We have, the next slide, we're going to talk a little bit about stages of chronic kidney disease. There are 5 stages. Stages 1 through 3 usually do not have very obvious symptoms. A lot of times we can go through life and start having kidney problems and not even be aware of it. So it is important anytime that, the physician orders urine test or testing of any kind, we really need to try to be compliant with that, because sometimes we find out just by luck of the draw that we do have problems. The earlier we catch kidney problems, the more likely we are to be able to take care of it and not have those complications advance. Stage 4 means that the kidney is severely damaged. Once that kidney is damaged, it really doesn't go back to being perfect again. So that's something important to know. And then stage 5 means that kidney is failing, or you already have kidney failure. And as it says on the slide, most people with early stage kidney disease do not know they even have it. Okay. So now we're going to talk about specifically this stage where we have kidney failure. It is also called end-stage renal disease. So you guys might hear that instead of kidney failure, or ESRD. That's the name people frequently refer to it. So when a person actually has this end-stage renal disease or kidney failure, that means their kidneys are not functioning well enough to keep them alive. So that is the most severe stage, of course, and we have to figure out what we're going to do about that. So a person with kidney failure will need dialysis or a kidney transplant to survive. So at that point, they would discuss this with the physician, and together with their family, hopefully they will come up with a solution that the patient is willing to do. And not all people are willing to go on dialysis. Some people just want comfort measures, and the physician will give medications to try to keep them as comfortable as possible until their kidneys completely fail and they end up passing away. Okay, so I'm here today because we are playing to win. We want to win this. We do not want end-stage kidney disease. We do not want any kind of chronic kidney disease. We want to stay on top of it. So to beat it, we need to understand what causes it. So here we go. First of all, who can get kidney disease? Basically, anybody can get kidney disease. People with diabetes or high blood pressure are much more likely to get kidney disease than other people are. Some other things, if you have heart disease, if you have a family member with kidney disease, African American, Hispanic, Native American, or Asian Pacific Islanders are also at an increased risk. And those folks are also at an increased risk for high blood pressure and diabetes. So that kind of adds to the risk. And then anybody over 60 years of age can be at risk for kidney disease. So this is actually why I'm here. If everyone is wondering, Linda, how did you become a person that was so interested in kidney disease? I am a certified diabetes educator, and part of diabetes, as it said earlier, diabetes can lead to chronic kidney disease and chronic kidney failure. So as a diabetes educator, I became interested in finding ways to educate the diabetes population so they can kind of have a good quality of life and prevent any complications down the road. But diabetes is the leading cause of kidney disease and kidney failure. almost half of kidney failure cases are caused by diabetes. So when we're thinking about that and how do we manage this, how do we keep from getting chronic kidney disease? Well, a good suggestion is trying to prevent having diabetes, right? So diabetes can be genetic, it can run in the family. It can be our unhealthy lifestyles that are causing diabetes. Okay, so the next slide here. This kind of gives a little more detail about diabetes and chronic kidney disease. So diabetes is caused when we do not make enough insulin or our insulin is not working properly. When we don't have enough insulin or it's not working properly, it interferes with taking the glucose, which is broken down from the food we eat. It prevents the glucose from being able to get into your cells where you burn it for energy. So when that happens, we have all this glucose stuck in the bloodstream, and that's how we develop diabetes. And the elevated glucose also damages the tiny filters in the kidneys. Diabetes also does other things. When your glucose is extremely high, it makes your blood real thick and sticky. And so if you think about something the consistency of, say, some really thick ketchup, trying to push through the veins and go into the very tiny cells in all parts of your body, that's how you get your energy, that's how you get your nutrition for your cells. So when that blood is real thick and your glucose is really high, you're really overworking all of the vessels. And that's another way that you can get complications. So the kidneys have to work really hard to try to remove the excess sugar in the blood as well. That's one of the things that kind of filters out a little bit. Because of being overworked, the kidneys can become damaged. And once they're damaged again, you can't go back. So this shows the healthy kidney above. And you can see the sugar on the left is coming into the kidney. That's the bloodstream. The blood vessels kind of help filter it out. And on the right side, you can see the kidney did not put out all that glucose. So it helped filter some of that. The second picture of the kidney, you can see in the bloodstream, the sugar's coming into the kidney. And on the right-hand side, you see all the sugar is coming out of the kidney. So it did not filter properly. And again, now we have high glucose, high blood sugars, and that will continue to cause problems. So just some information, the normal blood glucose level is roughly between 70 and 99 for fasting, non-fasting 100 to 140. And this is the information from the American Kidney Fund, the program that I'm doing the presentation through. There are some other, perhaps some other numbers that are just a little bit different than this, but this is the one we're using for the presentation today. Okay. The other thing I wanted to add, we also sometimes do A1C readings. So to decide whether a person has diabetes or not, they're going to draw blood. They're going to look at their fasting glucose or their non-fasting glucose. They also may draw an A1C. So your glucose is on the screen, the 70 to 99 and 100 to 140. That is a reading of your glucose at that very moment. So right then, that's what your blood sugar is. And your blood sugar goes up and down all the time. So if you check it 20 minutes later, you might get a different reading. The A1C is a test that was developed to measure the average glucose over the last 90 days. So you can see the A1C is a really useful test as well, although this program didn't have any information in the slides about it. I did want to just throw it out there about the A1C. If you give me just a second here, I thought I had those numbers right in front of me. Write those down just for everybody. So I don't know how many people out there have diabetes, but It's a good thing to keep these numbers in mind. The A1C, I believe I'm going to go out on a limb here. It's in the 5.7 range to 6.4, I believe, is prediabetes. Anything below 5.7% is normal for an A1C. Anything above 5.9 and above could indicate diabetes. So they also don't use the A1C for diagnostic purposes at this point, but it is kind of a nice number to do, to kind of know where you're at, particularly if you do have diabetes. It's pretty easy to go in the doctor and, have been done really well in the last week with eating and managing, your sweets and appropriate diet, and you could actually get a really good number, a really good glucose number. But if you go back and look over the last 90 days, that's really a better measure as far as knowing what you've been doing and if you're on track or not. High blood pressure or hypertension is the second leading cause of kidney disease and kidney failure. So 25% of chronic kidney disease is made up of people with high blood pressure. So now we know the top two causes. The first one's diabetes, the second is high blood pressure. So we're probably going to see that come up in the slides later on how we can try to prevent problems. So information about high blood pressure and chronic kidney disease. So when your blood pressure is high, it means that your heart is working really hard. It's pumping really hard, it's pushing out really hard, and that can damage the arteries and the vessels. So the pressure, when your heart is pumping and that pressure is really high, the pressure in the kidneys can also get high, and that causes chronic kidney disease as well. Our healthy blood pressure is 120/80 or below. Those numbers have changed over the last few years. So they've kind of narrowed the window down for high blood pressure. They're trying to keep people in a lower number so that they can prevent complications down the road. High blood pressure is considered 140/90 or higher. So the top number of the blood pressure is the amount of pressure against the vessels when your heart is pumping the blood out. So your heart pumps blood out and then it relaxes and fills back up. So the lower number, which is called the diastolic, the top one is the systolic, the lower one's the diastolic. So on the 120/80, the diastolic is the 80. That is the amount of pressure against the vessel walls when your heart is relaxing and filling back up with blood. So that's a real common question when I do blood pressure clinics. They ask me what those numbers mean. So really, we're just looking at the pressure against in the vessels at that time. So kidney disease can also cause high blood pressure. So the kidneys work to regulate blood pressure. When the kidneys are damaged, they can't do their job as well as they should. And so if they kind of play a role, both diabetes and blood pressure, we have complications from those diseases, but they can also add to the diseases as well. Now here are some other people that are at risk or higher risk. If you have heart disease, you're going to be at higher risk for chronic kidney disease as well. A family member with kidney disease, we do see that sometimes it kind of runs in the family a little bit. So it's kind of good to know the history of your parents, your grandparents. That kind of helps the doctor know your past, know whether, what they kind of need to look for, and maybe do a little more screening. And then we talked about ethnicity and how these folks are at risk for both diabetes and high blood pressure. They're at a little higher risk than Caucasians are. And of course, if you're over the age of 60, it's kind of like anything else in life. The longer you use something, it starts to wear down a little bit. Okay, let's see what we got next. So now we're going to get to the playbook. And the playbook, of course, is a book of strategy, the things that we do to try to, in this situation, to try to win. We want to win. And this would be something that a sports team would use, during a game to absolutely be the winner. It includes defensive and offensive plays as well. So our defensive plays, these are the actions we're going to use to prevent chronic kidney disease and kidney failure. So of course, we talked about the two main causes of chronic kidney disease with diabetes and high blood pressure. So we want to control your blood pressure. We want to control your high blood pressure. Your high blood pressure and your blood sugar. The better control we have over those, the less chronic complications, hopefully, that we'll be looking at down the road. Being active is always very important. It does all kinds of things for health, but it also helps keep our weight down. It keeps our blood pressure down. It can keep our blood sugar down as well. So setting the goal of maybe 30 minutes a day, that's kind of the recommendations. 30 minutes a day for 5 days a week, or 150 minutes a week is the recommendation. And that is a good recommendation to maintain your current weight. If you're looking at losing a little weight, you need to add a little more time to that in order to be able to drop some pounds. They recommend being creative, do something that you love. If I go out and assign you to walk a mile a day every day, 7 days a week, and you hate walking, the chances that you're going to continue that habit is very poor. However, if you love music, I could recommend maybe walking a mile a day, 7 days a week, putting on your headphones and listen to your favorite tunes. So we always want to mix activity with something that we really enjoy. Don't pick something that you don't like. And if you do pick walking and you like walking outside, make a plan for wintertime, because when it comes around and the weather's bad, you may not be able to do that. So just have a backup plan, whether that be getting into the YMCA or even Gladstone Community Center here. They have a beautiful facility. Making a plan to do walking around their track. So this comes as no surprise, I'm sure, eating a healthy diet to prevent kidney disease, diabetes, and high blood pressure. You guys want to keep a low salt diet. Now I'm sure that somebody's going to ask me, how much is a low salt diet, right? Or how much salt should I have if I already have kidney problems? So I am not a licensed dietitian. What the recommendations are is that you discuss that with your doctor. I've done some research on it, somewhere between 750 milligrams to, I believe, 2,500 milligrams. But as you can see, those recommendations are going to be based on your personal health and perhaps what stage of disease you're in. So you are going to want to talk to your doctor about how much salt you should be taking in on a daily basis. We want to limit our unhealthy fats and our sugars. Chips, soda, all that good stuff, cookies, cakes. We want to limit that. It doesn't mean you have to always eliminate it. We want to do it in moderation and just make it a special event. We don't want to eat it 7 days a week, but maybe once a small piece every couple of weeks might be good. You want to eat a diet rich in fruits, vegetables, and whole grains. And really want to look at portion control. Portion control helps with keeping your glucose under control. It also helps lower your weight sometimes. And okay, and we're going to move on. I think there's a few slides on diet. Avoid foods and meals that are prepackaged, frozen, canned soups, or deli meats. This is kind of important, and it gets really complicated. A lot of people that are single and live alone, when you buy food at the store, sometimes it's more than what you can eat. So people turn to these types of things, deli meats, hot dogs, cold cuts, frozen dinners, canned soups, and deli meats. So always look at the label. You're looking for the amount of sodium in it. That's another name for salt. And just try to limit that. Try to make your meals, less fatty, make them fresh. If you do end up doing some canned vegetables, they recommend frozen or fresh vegetables. That has very little salt. If you do end up using canned vegetables, you can rinse them off in your sink. Use a colander and rinse them off, and that will remove some of the salt that are on the vegetables. We want to limit our fast food, salty snacks, chips, as I said, and pretzels. Always eat fresh or frozen vegetables if you can instead of the canned, which, as it says here, they often contain higher salt. I know there are some canned foods that are packaged with a lower salt label. Still go ahead and look and see how much salt is in there. You might be surprised sometimes. And then as an alternative to salt, try experimenting with some different kind of herbs that you might have in your cabinet. Lemon juice, spices, but again, if you're getting a spice that is mixed, that has more than one seasoning in it, make sure you're looking to see if there's sodium in it, because sometimes that's in there. It may say that it's a low sodium, mixture, and it may actually have a little more salt than what you should be having. You want to limit that unhealthy fat. Choose lean meats or fish. Try beans, lentils, and instead of meat. And instead of butter, they recommend olive or vegetable oils. And limit your saturated fat and avoid trans fats. A good rule of thumb is maybe just to try to stay away from those fried foods if you can. That's a really good opportunity. Grilling, maybe baking might be a better option for you. And then, of course, limit sugar. We know that all of those sweets and chips and cookies and all that stuff that I tend to like and try to avoid, they can certainly make your blood sugar go up and lead you down the path to diabetes, which can also lead down the path again to chronic kidney disease. So avoid sugar drinks, soda, sweet drinks, coffee with a lot of sugar in it as well. Fruit juices can be a good thing to drink if you do want to not get ones that have added sweeteners to it. And 4 ounces of fruit juice can actually be a treatment for low blood sugar. So you wouldn't want to go out and drink tons of just juices. That can raise your blood sugar as well. For a sweet snack, they recommend sticking to the fruits themselves. So peel an apple or cut up an apple, do oranges. The pulp in that kind of helps when it's broken down. The glucose isn't released as fast as it is when you drink the actual juice. That's kind of a good thing to know. Don't give up your fruits. They can be your sweets. And you always want to eat fruits with high nutrient value. So fruits, vegetables, and whole grains. And I think that's pretty much recommended for any disease just about that we have, is that we want to make sure our diet is healthy and we're not eating a lot of the junk foods. Control portion sizes, we talked just briefly about that. There's a lot of ways you can trick yourself into thinking differently. For example, most of the plates today are very large. When you go back into history, you will find that way back when they had much smaller plates. And so when people would eat, they would fill their plate. Now when we use the bigger size plates, we're actually putting a whole lot more food on it. So if you take a smaller plate when you're eating your meals, and you can fill that smaller plate up, it kind of tricks your mind into thinking that you're eating a full meal. So that's one little trick. The other trick is maybe to try to eat slowly. It takes about 20 minutes for our body to recognize that we are full. So you could actually be eating your meal and you're actually full, but you're eating for 20 extra minutes that you don't really need. So we try to eat slow, drink fluids, drink water with it is also some other tips. Make sure you're reading the nutrition labels. Also, a couple of tips: don't eat in front of the TV. That can be a really bad habit. We call it sometimes mindless eating. We get sidetracked watching TV. We might be snacking on something and you end up eating a whole lot more food than you actually recognize or realize. So we do recommend meals at the table, or at least with the TV off, so that you're really paying attention to your meal, what you're putting in your mouth and how much. These are some really cool measuring tips. We use this as well sometimes with diabetes. A typical 4-ounce portion is about the size of the palm of your hand. So that's about the recommendation for meat. A tablespoon is about the size of the top half of your thumb, and the teaspoon is about the size of the tip of your index finger. So if you don't have a scale and you're trying to figure out what 4 ounces is, that's kind of a general rule of thumb. And this is the healthy eating plate. I know there's several different plates out there. This one's a little more detailed than the ones I've seen in the past. but it still has the same basic concept. Your fruits and vegetables should make up half of your plate, with the fruits being, a little less than the vegetables. Whole grains can make up a quarter of your plate, and then your healthy proteins can make up the other quarter of your plate. Water is always a great thing to drink. They don't recommend anything with sugar in it. Kind of fuels your hunger and thirst, and then you tend to eat a little bit more. And milk and dairy, they do recommend only 1 to 2 servings a day, and juice 1 small glass a day. And again, avoid those sugary sweets. As far as the vegetables, we haven't talked specifically too much about them, but they do like the colorful vegetables. So the better variety of color, the better off you are. So you can have red peppers, green beans, cabbage sometimes is good as well. And then as far as the fruits, they also recommend eating a variety of fruits as well, not just a single type of fruit. Okay. Healthy protein, I'll just touch a little bit on that. They do recommend fish, poultry, beans, and nuts. Again, limit that red meat. And try to, if you have a fatty piece of meat, try to cut that fat off before you cook it. You're looking for lean meat is the healthiest choice. So other lifestyle changes that we can make to protect our kidneys. If you do smoke, the recommendation is that you quit. And that's just not smoking alone, it's also tobacco. So if you chew, I would recommend giving that up as well. Alcohol can also play a role into your health. They recommend limiting alcohol. And recommendations for alcohol for women is actually 1 single drink. Men, recommendations if they drink is no more than 2. So when we talk about drinking, and I talk about drinking with people even with diabetes, they say they don't drink much, they just drink, 3 or 4 beers a night. As you can see, that's above the recommendations. Men, 1 drink, women, 2. Now, with that being said, please don't go out and start drinking. That's not the plan. But if you do drink, it's good to know what kind of recommendations that they have. And then also always work with your doctor. They can give you tips. They can guide you to programs that might help you achieve your goals, and continue to try to work on the health of your kidneys. So we know kind of what causes kidney disease. We know who's at risk. Now we want to find out, how do we know if our kidneys are healthy or not? And this is how we do it. The only way to know if you have chronic kidney disease is to get tested. They do urine test. That checks for protein and blood in the urine. And when our kidneys are damaged, we start seeing protein and blood spill in the urine. You may not be able to see it with the naked eye, so that's why they recommend, going to the doctor. Sometimes there's a minute amount of blood in there, and the urine test will show that. And that shows structural damage in the kidneys. This eGFR is the estimated I'm not even going there. You guys can read it on the screen because I can't say that word. The filtration rate. It's based on blood creatinine, which is the waste in the blood. They also look at age, sex, race, and weight to determine whether that number is going to be abnormal or not. So if a 20-year-old has a certain reading, the normal for a 20-year-old can be very different from somebody who's 60 or 70 years old. So they take all of that stuff into account. And it basically shows how well the kidneys are filtering out the waste. So that is a very important lab test that gives us a lot of information about kidney health. A doctor will consider if that eGFR level over 3 months, he will look at that for 3 months to decide if a person has kidney disease. So that's something as well to know. Now we're going to look at the GFR and how that where you fall into the different stages based on your numbers. So if you have kidney damage, stage 1, if the eGFR is greater than 90, this means that there are some signs of kidney damage. So you might see protein in the urine and some kind of physical damage to the kidneys. So our goal is we really want it greater than 90. Stage 2 kidney damage is when that number is between 60 and 89. That also shows some sign of kidney damage. Also, protein can be in the urine or physical damage to the kidneys. And then stage 3 means the kidneys are moderately damaged. And again, I just want to remind everybody, you can have stage 1 through 3 kidney disease and not have any symptoms at all that you know of. Sometimes we get sick, we go to the doctor for other reasons. The doctor may do a urine just to see what's going on, and these numbers can be abnormal. So we want to try to keep them as healthy as we can. As I said, when doctors want to see you for follow-up visits and do urines, please don't turn them down. We want to know what our kidneys are doing. Stage 4 kidney disease is 15 to 29, is that lab result. This means your kidneys are severely damaged. They're not working near as well as they need to be. So at this point, you're probably seeing some symptoms and complications. And then we move on to stage 5. If your result is less than 15, that means the kidneys are getting close to completely failing or have already failed. So by the time you hit stage 5, most likely you're a pretty sick individual. If you haven't been to the doctor yet, that will probably take you to the doctor. Okay, now we're going to look at our offensive plays. So how can we manage chronic kidney disease and treat kidney failure if we've already gotten there? So depending on the stage of kidney disease, it can be possible to prevent it from getting worse. So we need to, again, control the blood sugar, control our blood pressure, eat healthy, stay active, quit smoking, limit alcohol, work with your doctor on measures to try to get those things under control. And then you can talk to the doctor about certain types of medications that can protect the kidneys. ACE inhibitors and ARBs are certain kind of medications that we sometimes use. We see people with diabetes often have high blood pressure as well. So we see some of those medications used with diabetes also. So kidney failure, once you reach kidney failure, you really don't have a lot of options. You can get a kidney transplant, you can do dialysis, or you can choose just to live your life out as comfortable as you can. Dialysis does not make the kidneys better. It does part of the job that your normal kidneys do. There's different kinds of dialysis as well, and we're going to just briefly look at that. First, we're going to look at the major symptoms of kidney failure, though. So these are the kind of things that would take you to the doctor if you were probably in stage 4 or stage 5. Actually, this is listed as kidney failure. Back pain, dry, itchy skin. That dry, itchy skin is really, really common. People that are in kidney failure that choose no treatment and just comfort measures only, you can run your finger across their skin and there's actually crystals that kind of come out of their pores and they feel a little grainy. It's very interesting to note that, but that can happen. A metallic taste in your mouth, confusion, fatigue, nausea and vomiting is very common, loss of appetite, swelling occurs, urine is dark, foamy, and or bubbly, and usually the urine output is a lot less. So sometimes that's what takes people to the doctor is they feel terrible, they've been sick for a long time, you know, they're not having any urine output, they're trying to drink water, they're not hungry. And here it says actually urinating more or less than normal. What I've seen in the past has been less, but it can be either, it looks like. So treatment methods. Here we're going to talk just briefly about the different types of treatments that we can do. So hemodialysis, peritoneal dialysis, a transplant, and supportive care. Hemodialysis is usually done in a clinic, I would say most of the time. They put a shunt usually in your arm, and then they hook that up 3 days a week, and They run the blood through the machine to clean out the waste, which is basically what your kidneys would do. However, of course, hemodialysis isn't near as fun as being at home, so it can be very taxing and it's very tiring on individuals. Usually takes about 4 hours each time, 3 days a week. If done at home, treatments can take 2 to 3 hours each time, 6 days a week. So for the most part, I've only seen people that actually come into dialysis facilities that are doing the hemodialysis. Peritoneal dialysis is just a little bit different. They use the lining of the abdomen called the peritoneum and a cleansing solution called dialysate to clean the blood. This can be actually done in any clean, dry place. So this is something that you might see people do at home. I have had a couple of patients that I've taken care of in the past that actually do this at home. The company sends out these big, gigantic bags of liquid and you hook it to, basically it's a catheter that comes out of the peritoneum. It can be done at work, home, or school, and it's done continuously throughout the day. So they hook that up and the fluid runs in, it stays in the abdomen for a certain amount of time, and then we drain it out. And it collects kind of the waste, so when it drains it out, it pulls out that waste with it. I thought I actually had another slide on that, but I think that's it. I've seen this used a lot in rural areas where they don't have dialysis centers. So a lot of times people that come from rural areas may have to travel an hour and a half, 2 hours to get to a facility where they might do the other type of dialysis 3 days a week. So sometimes they send them home and they teach family how to assist with doing the peritoneal dialysis. Okay. And kidney transplant is another option. Removal of a healthy kidney from one person, excuse me, I misread that. So kidney transplants occur, we get our transplants from people who donate a kidney to somebody. It may be a family member that, you know, they're real healthy, don't have any health issues, and they may be able to give a kidney to somebody who needs it. Also people, when they pass away, they may have signed the back of their license to be an organ donor. The majority of them, I think about 17,500, comes from people that have donated after they passed away. About 5,500 come from family or healthy individuals that are actually donating one of them to somebody. Something to know, when a person receives a kidney transplant, they have to stay on immunosuppressant medications for the whole duration of the time they have the transplanted kidneys. And those medications work with the body to try to keep the body from rejecting it. Sometimes our body, it's not our own, so we tend to try to not want to, you know, our body kind of fights against it as something foreign. And the immunosuppressant medications help with that. So supportive care would be somebody that was not willing to do any kind of dialysis and they weren't a candidate or willing to do a transplant. So in that situation, the family and the doctor and the patient talks together and decides what the patient considers to be a quality, quality life. So they may make decisions based on symptom management only, and that helps keep that person comfortable until their time comes. More common among older patients and patients dealing with 2 or more illnesses at the same time. So sometimes people do refuse dialysis and they just want to live their life out to be as healthy as they can for as long as they can. So this is just a recap of the program today. When the kidneys are permanently damaged, they do not work as well as they should, and that is called chronic kidney disease. Diabetes and high blood pressure are the most common causes of chronic kidney disease and kidney failure. Again, 50% of people with diabetes, we see them with kidney failure, 25% with high blood pressure, also with kidney failure. The best ways to prevent kidney disease are to keep a healthy blood sugar and a healthy blood pressure. And that is something that, is relatively within our power to control. There are some people that it's genetics, but many people, if we look at what we're eating, how we're exercising, how we are managing our health on a day-to-day basis, sometimes we can really swing those numbers into healthy ranges and prevent complications with our kidneys down the road. Finding and treating kidney disease early may help prevent kidney failure. And the only way to know how your kidneys are working is to get a blood or a urine test. Okay? And that is the end of our program. At this time, if anybody has any questions, I'd be happy to try to answer them. If I don't know the answer, I will move them on, and if we'll take your name and your question, and I can find out an answer, and I will email you all back. There is a chat box. Let me see if I can find that on my screen, Shanna. Is it up there at the top? Here, go for it. My helper here, Shanna, she is awesome. There's my chat box. Okay. So if you have a question and you guys want to just type it there in the chat box, I'll be happy to try to answer them. I really appreciate everybody coming out. This program had a lot more registrations than I would have expected. It was very well. A lot of people registered for it, so I appreciate you guys coming and listening. Again, I work at North Kansas City Hospital. My name is Linda Craven. I work in the community health and wellness part of the hospital. And I will go ahead and throw my phone number out there if anybody wants to contact me that way. My number is 816-691-1688. And for those of you that don't know, we do have some nephrology doctors, which are kidney specialists, that is located at our hospital. If you guys are interested in seeing a kidney specialist, that's who you would, that's where you would be looking. And if you're interested in names, I can get that for you all as well. Okay, question. Will the slides be available? Yes, I can make the slides available to you all, I believe. I can email those out. Okay. Anybody have any other questions? I also want to say, if you guys don't receive the Your Health magazine, Shannon, do I have that one up here? This is a magazine that the hospital puts out. It has all of our education programs and fitness programs in it. We very frequently have free programs on diabetes, healthy eating, all kinds of different things in there that might be something you guys would be interested in. We do free cholesterol and blood sugar checks once a month at the YMCA in North Kansas City, and also here at Gladstone Community Center. You can access that by going to nkch.org, or you can email me and I can send the information. If you don't receive the magazine and you're interested, please shoot me an email and I'll make sure you get on the list to receive that. I don't see any more questions. I just want to thank you guys for attending the North Kansas City program. Greatly appreciate everybody, and feel free to send me questions if you decide after the fact that you have some. Have a great evening.